My name is Dorinda Hill, and I am the WellCheck Community Health Worker here at Dayton Children's Pediatrics. See all of the babies 0 to 15 months, so very busy. We are trying to make sure they are making their WellCheck appointments. So typically, I try to see them at their first visit, so they're usually a couple of days old. If it's a toss-up between going to your child's appointment or going to work so I can put food on the table, 9 times out of 10 parents choose to go to work. Even if they know there is a need for their child to be here, they feel like that is more important, because if they can't eat, then we can't do anything. What we have found, and I have found, that it is, if I meet them then and I try to do face-to-face visits, there's typically, I can catch any barriers that they have. And if there's other needs happening at home, such as the transportation or food or bills or needing to work, my role is to help address those needs so that they still come and they see that you can still focus on the things at home, and your child's health is just as important, and you don't have to choose which one is more important, that we can do them both together. There has been a particular family that had lots of needs, and we just thought it was housing and food initially. The family, it was time to leave, and we were helping them load up. And the kids were both underage and should have been in car seats, and there was not a car seat in sight. And when we were talking to the mom, she said she's never had one. She didn't. The kids didn't have anything. And we all took off to get car seats for the kids. For once putting the car seats in there, they didn't have enough room for the food boxes. So I followed them home to make sure that they were able to get the food. And so after getting there, the kids didn't have beds. They didn't have anywhere to sleep, clothing. She said this is really it. This is all that they had. It really painted a picture that this is real, that families don't have things that we have. And I'm thankful and I'm grateful to be able to do what I can to help. This is just a reality for some people, and even for myself, that I don't live, but working in it, it is very real, and that was definitely life-changing for me. And so since then, it's always like time to get into action when I see anything that needs to be addressed immediately. We've had families that come in and they're not properly dressed for the season. What do we do? You know, it's freezing outside. The kids need a coat, they need socks, they need these things, shoes. With Dayton Children's being the staple in the community, there are, on a daily, maybe 20 families that I get to see. There's always more, but to have the resources, to have more employees to do what we do, to be able to see these families and meet their needs and help bridge the gaps. And it shouldn't be who needs it more. If it is a need, we should be able to address it. So having the resources to be able to address the needs for all families when we see there is a need is important. We can do more so that all kids can thrive, not just in our clinics, but in our communities.